Problematic drug use is on the rise in the United States and has been for some while. According to the Centers for Disease Control and Prevention, between 2000 to 2015, more than 500,000 people died from drug overdoses. Giving another statistic that may be easier to grasp yet is more startling, the CDC claims 91 Americans die every day from an opioid overdose. One can see a clear, dramatic increase since the 1980s. Overdose deaths remained below 10,000 deaths per year between 1980 and the early 1990s. However, since then there has been an accelerating increase. The New York Times found that roughly 64,000 people died from drug overdoses in 2016 alone. Trying to combat the drug epidemic, the Ronald Reagan administration revitalized the war on drugs, particularly with Nancy Reagan's Just Say No campaign. This war included a much more prominent law enforcement role. Federal drug-related expenditures for law enforcement, treatment, and education rose from $2.6 billion in 1985 to nearly $13 billion in 1993. Unfortunately, the increased prominence is not actually combating the issue, evidenced from the statistics given above. Unlike what we have done in the States, Portugal is particularly interesting to examine because of their decriminalization of all drugs and the further change to treat drug use as a medical administrative issue rather than a criminal one. Caitlin Elizabeth Hughes and Alex Stevens, in their 2010 article, What Can We Learn from the Portuguese Decriminalization of Illicit Drugs for the British Journal of Criminology, discuss that data obtained from Portugal after its decriminalization experiment began. A point Hughes and Stevens are careful to make is that there was, in fact, an increase in lifetime and last year use reported between 2001 and 2007 for all adults. However, this trend is mirrored in neighboring Italy and Spain, suggesting a regional factor that led to increased rates of drug use rather than the decriminalization in Portugal being solely responsible. However, despite this, rates of young and problematic drug use declined during the same period in Portugal and not in Spain and Italy. So, though there may have been an increase in drug use which coincided with Portugal's decriminalization of all drugs, the decriminalization of all drugs actually led to a decrease in problematic use and use among children and adolescents. One could see a change in attitude towards drugs and drug use. However, it seems to be a more responsibly permissive attitude and not a recklessly promiscuous one. Moreover, the decrease in problematic use was matched by a positive change in harm to health because of drugs. These changes include reduction in mortality rates, especially opioid-related overdose deaths. The authors write, the proportion of death in which opiates were the main substance in Portugal has continued on an almost steady decline from 95% in 1999 to 59% in 2008. However, the authors remind the reader, reductions in opiate-related deaths are likely to reflect the large increase in the provision and uptake of treatment and not simply the effect of decriminalization. Also, data from hospitals and treatment centers find that the population of drug users has aged since the reform, suggesting again that the decriminalization and medicalization of drugs and drug use has led to a reduction in the number of young people who are dependent on illicit drugs. Another benefit of the reform in Portugal is a reduction in drug users diagnosed with HIV or AIDS. The authors write, between 2000 and 2008, the number of cases of HIV reduced amongst drug users from 907 to 267, and the number of cases of AIDS reduced from 506 to 108. Yet, despite the positive results and benefits seen in Portugal and other countries, the United States is still resistant to a non-punitive, medically oriented approach. This resistance is a symptom of a political attitude which bears immense responsibility on the individual to uphold some ideal moral code, often Christian, while paying little attention to or ignoring altogether the effects of societal influences. This is not to say that everyone is simply a victim of circumstance. However, it is important to understand the real effects external circumstances have on the individual while understanding the capacities and limitations of individual action. Unfortunately, the extreme individualistic attitude is a prominent one in the United States, and when it came to drug education, that attitude was the one adopted. The DARE program infiltrated the school system, covering all 50 states. The then Los Angeles Chief of Police, Daryl Gates, and the Los Angeles Unified School District launched DARE in 1983, starting a drug abuse prevention program that would grow across the nation. Nearly 75% of the United States school districts adopted the DARE program within a few years. Usually delivered by a uniformed police officer, the program starts between the 4th and 6th grades, with some programs extending until the student's senior year of high school. Striving to teach students to resist peer pressure and lead safe, drug-free lives, the program's mission is a world in which students everywhere are empowered to respect others and choose to lead lives free from violence, substance abuse, and other dangerous behaviors. In 1994, however, Earl Weinstein and the others on the paper analyzed information and data from DARE and surveys from DARE participants. Their analysis concluded that there was no change in lifetime prevalence of drugs, how recently someone used drugs, the frequency with which one uses drugs, or the grade in which one first used drugs for high school seniors who had taken DARE and those who had not. There is one finding which did show a difference, however. When broken down by types of drugs, the seniors who had received a DARE education were more likely to have recently used a hallucinogenic substance than those seniors who had not taken DARE. This suggests that DARE is not only ineffective, but may, in some cases, be counterproductive to their own goals by exposing children to drugs and sparking their interest in the different effects drugs have. Moreover, the authors found that there was a sharp decline in positive attitudes towards the police and a growing unwillingness to condemn peers' consumption of alcohol. Further, the authors of the study found that the DARE program fostered an attitude among students of distrust and disdain for adult authority figures. This apparently did not reach the ones in charge of DARE, though. In a Senate hearing, the Arizona Project DARE coordinator claimed that police chiefs report that there is a higher respect for police officers, and school administrators and teachers report there is a higher degree of respect for authority in general among the students that have received DARE. However, it is easy to see the claim as erroneous from the data above. What is more, claims like the one the Arizona coordinator made often go unchecked or unchallenged, allowing the public to continue to stew in their false sense of security from the social programs. After examining the DARE program and seeing its failed attempts to curb youth drug use and the growing drug epidemic, a clear need for a better approach to drug use and abuse is needed. Moreover, with looking at the success of other countries which have taken a non-punitive medical approach, especially the success of Portugal, it seems evident that a need for a scientific medical approach should be met with better drug education programs and better administrative responses to drug use. Taking guidance from Portugal and looking to their system for pointers would be beneficial, but it's also important to understand the differences between the United States and Portugal. For one, the United States is a far larger country than Portugal, and regional approaches may fare much better in the States. Also, apart from the new educational program, should be an aim to educate students much more about the circumstances that surround drug use and its mental health aspects. Just say no is an oversimplified answer to an incredibly complex psychosocial problem, and the overly individualistic politics which allowed for such an approach to flourish must also be tackled in such a program. Thank you.